Okay, so this is the fifth part of our hypoglycemia or our diabetes lecture, and it's going to be on hypoglycemia. And let's start with hypoglycemia. And I taught you guys a few slides ago that the normal blood sugar is 70 to 110. So hypoglycemia is low blood sugar, so their blood sugar is less than 60. And it's most commonly caused by too much insulin, but it can also be caused by not enough food or too much exercise. And for those of us that have normal metabolism, what happens is our bodies will go into what we call a counter-regulatory response, and it will prevent hypoglycemia from happening. But in diabetics, this counter-regulatory response does not work. And so therefore, when their body releases glucagon, it doesn't raise their blood sugar, and when the sympathetic nervous system or the epinephrine response hits, it also doesn't cause their blood sugar to go up. So with a diabetic, their blood sugar continues to fall until we have some type of intervention for this person. Okay, now if you look at the bottom, there's going to be two major categories of the signs and symptoms of hypoglycemia. If you look on the left, this is a mild hypoglycemia, and I wish you could see a patient, I could put one on a stool right in front of you that was diabetic, and we gave them a little bit too much insulin, and as their blood sugar drops down below 70 or 60, what you're going to see is the person will initially become kind of shaky, maybe irritable, a little nervous, tachycardic. They may have palpitations, tremor, hunger. They'll become diaphoretic, become pale, and maybe complain of paresthesia. Now, these are all mild signs and symptoms of hypoglycemia. This is where the sympathetic nervous system is kicked in, or the adrenergic response, and because of the epinephrine that's released, it causes them to be, shaky and nervous and have palpitations. And then as the blood sugar continues to drop, then we have our second major category, and this is where the blood sugar drops down, less than like 50 and 40, and it's getting down quite low. And this is what we call the neuroglycopenic manifestations. Neuro, meaning brain or nervous system. Glyco means sugar, and penic means low. So this is a low blood sugar to the brain. And just like it says, they're going to have difficulty thinking. They may be confused, complain of a headache, have slurred speech, blurred vision, lethargy, loss of consciousness, can lead to seizures, coma, and death. Okay, and this is just a recap, some of the signs and symptoms of hypoglycemia. It talks about on the top there, it can be caused by, not enough food, too much insulin, or too much exercise. Usually the onset is sudden, and like we said, the blood sugar is going to be less than 70 or less than 60. And what can we do? Like it says there, we need to give them some kind of sugar to raise their blood sugar levels because it's getting pretty low there. Now, if you look at the funny little diagrams there, it just goes over the common signs and symptoms of hypoglycemia. Shaky, sweating, anxious, dizziness, hunger, increased heart rate. Often it's a weak, thready pulse, impaired vision, weakness, fatigue, headache, irritable. And a great little saying that we use for people that are hypoglycemic, and we can teach our patients this: the signs and symptoms of hypoglycemia can be remembered cool and clammy, give some candy. Okay, now with this slide here, I can see a bunch of test questions, so I'd make sure that you know this. So hypoglycemia interventions. We talked about hypoglycemia being low blood sugar, so what does the person need? Well, it's obvious, they need blood sugar. So we don't know how low their blood sugar is, and so usually the best intervention initially would be to check their blood sugar level, and that would give us their blood sugar reading. And then at this time, a lot of times you're going to call the doctor, and when you call the doctor, you're going to say, hey, my diabetic patient, I believe, is hypoglycemic, and they'll ask you, well, what is their blood sugar? And you'll say, oh, it's 50 or 40. And then the doctor is often going to tell you, make sure that you give the person some kind of sugar, and they'll write an order for you to proceed. Now, I want to highlight a couple really important items here. If your hypoglycemic patient is awake, alert, oriented, then the best way to give them sugar would be by mouth. So give them oral sugar, some type of juice, milk, candy, something like that would raise their blood sugar levels up. But please listen here. If they're unconscious, if they're obtunded, if they're not responsive, then we never give anything to them by mouth, and we need to give them either a glucagon injection or IV glucose, and it's usually in the form of D50W. So let's look at some of the interventions down below here. If we look at mild hypoglycemia, you can see that the person's blood sugar is, a little bit below 70 or 60, and the sympathetic nervous system kicks in, and they're going to have the tremors, the tachycardia, they're going to be sweating, maybe some paresthesia, hunger, pallor, shakiness. And what this person needs is about 10 to 15 grams of carbohydrate. And examples of that would be about 4 ounces of orange juice, 6 ounces of soda, 6 to 8 ounces of skim milk, it's usually what they give, 6 to 8 lifesavers, maybe a small tube of cake icing, or 4 teaspoons of granulated sugar. And if we don't catch them at this point and their blood sugar continues to drop, then they're going to go to moderate hypoglycemia. And this is where they have all those signs and symptoms that we just listed, but now it's going to start going to the neuroglycopenic, where the brain is affected. And so they'll have headache, irritability, they'll have a rough time concentrating, they may be drowsy, slurred speech, blurred vision. And this patient needs about 20 to 30 grams of carbohydrate. And examples of that would be 8 ounces of orange juice, or 12 ounces of soda, or 12 to 16 lifesavers, or 8 teaspoons of granulated sugar. Or you could give them a glucagon injection. This can be given either IM or sub-Q. And if you look up in the upper right-hand corner, a lot of diabetics will have a little syringe of glucagon that they can give themselves. And it's usually given IM or sub-Q. And then if the patient continues to progress and they go into what we call severe hypoglycemia, this is where they have severe disorientation, seizures, unconsciousness, coma. Like we said before, would never give this person anything by mouth because of the decreased level of consciousness. This person needs about 25 grams of sugar, usually about 50% D50W through the IV, or give them a glucagon injection, or both. And just remember that statement that we talked about, cool and clammy, give some candy. Okay, and before we go on to our last presentation, or part number 6, I want to contrast the signs and symptoms between hypoglycemia and hyperglycemia. This is something that the nurse should be real familiar with. This is something that you want to teach your patient so that if they become hypo or hyperglycemic, they'll remember how to treat that. And remember, if you look at the very bottom there, the little mnemonics that we like to teach our patients, because it's easy to remember. If they feel cool and clammy, it usually means they're hypoglycemic and we have to give them some candy. There's also a little statement down there that says hot and dry, sugar's high. One of my colleagues teaches something to the effect, dry and hot needs an insulin shot. So this person is hyperglycemic and they need some insulin so they can use some of that sugar that they have. So let's begin with the hypoglycemia column there. If you look at their skin, it's going to be cool and clammy. They're going to be sweating and have profuse perspiration. If you look at their mental status, they'll be anxious, nervous, irritable, maybe have some confusion, and it can lead later on to seizures and coma. If you look at the symptoms, we also talked about weakness, double vision, blurred vision, hunger, tachycardia, palpitations. If we were to check their blood sugar, this person would have a blood sugar less than 60. They would be negative or absent for ketones, and the little mnemonic that we remember is for hypoglycemia is cool and clammy, give some candy. Okay, now in contrast, the signs and symptoms for hyperglycemia would be hot and dry, and we like that little statement, hot and dry, sugar's high. The reason why their skin is hot and dry is because they're dehydrated. And that's what the second little item there says, that they are dehydrated. They're going to have what we call Kussmaul respirations. And remember when we talked about acid-base balance, and we talked about how the lungs can help regulate acid-base balance, and how they do this is by blowing off CO2. And so when they become acidotic, this person will increase the rate and depth of respirations, and they're going to blow off the acid. And their breath is going to smell like juicy fruit gum, and they're going to have the acetone odor to their breath. Other mental status changes in hyperglycemia will be altered level of consciousness. They may be lethargic, they may be stuporous or comatose. Other symptoms would be nausea, vomiting, abdominal cramps, polyuria, polydipsia, polyphagia. And their blood sugar is going to be greater than 250. And a lot of times what we see in the hospital, it'll be up 300, 400, 500. And this person will be positive for ketones. Remember we talked about if you can't use sugar for energy, you're going to break down fats, and the byproduct of breaking down fats is ketones. And this is what gives that person the juicy fruit breath or that acetone breath. It's a really sweet smell to the respirations. And so they'll be positive for ketones. They'll spill it in their urine. And then remember the little mnemonic that we use in this situation is hot and dry, sugar's high, or dry and hot, needs an insulin shot.